I'm Dr. Sorensen, and today we're going to talk a little bit about amblyopia. Amblyopia is having reduced vision in one eye in the absence of an eye disease. And amblyopia is a developmental disorder that's typically caused by having a high prescription in one eye, but not the other, or having a constant eye turn in or out, or a congenital cataract. Patching therapy has been the main treatment for amblyopia for a very long time. But one of the drawbacks of patching therapy is that compliance tends to be poor because kids don't always like walking around with their better seeing eye covered up. Patching therapy has also been found not to be as effective in older children and adults. And that's actually important to know because the brain has significant neuroplasticity throughout life, or is capable of making changes throughout life. For a long time, people thought that amblyopia could only be treated in young children, but we now know that that's not true and that the brain is capable of change in older children and adults. We also know that the amblyopic eye has other problems besides just how clearly it can see letters on an eye chart. It has trouble with focusing, tracking, and has kind of a processing delay of visual information compared to the other eye. We also know that in amblyopia, there's a problem with how the eyes work together as a team. And that problem is called suppression. And what suppression is when both eyes are open, the dominant eye kind of inhibits or blocks the signal that comes from the amblyopic eye. And so when both eyes are open, the amblyopic eye really isn't contributing as much to the team as the dominant eye. And there's been a lot of recent research evaluating suppression and taking a look at it as a target for treatment, especially in adults. And they've had pretty good results on improving visual acuity with anti-suppression methods in research studies. So our approach to amblyopia involves several different things. We always first start with the best possible glasses correction. And that can be either glasses or it might actually be a contact lens for some patients that have a high prescription in one eye, but not the other. We then do incorporate some patching, but we do it with specific activities designed to improve tracking, focusing, and processing in the amblyopic eye. We also incorporate a lot of anti-suppression techniques, and that might be wearing kind of a filter on the glasses instead of a patch that gives the amblyopic eye an advantage over the dominant eye, or it might be doing several activities with red and green glasses where the amblyopic eye has to be on to see what the patient is doing. We then incorporate a lot of different activities to strengthen how the eyes work together as a team because we know that having good 3D vision is really important for maintaining the gains we make in amblyopia treatment. So the goal of the vision therapy-based treatment approach for amblyopia is to improve all the skills in the amblyopic eye, reduce suppression, and get the eyes working together as well as we can so that all the gains in visual acuity remain stable over time.